My name's Pam. I'm one of 8 hygienists in our office, and I have been a dental hygienist here for 35 years. And my role is to help provide health. I'm also the ambassador for the patient. Sometimes when the doctors make a recommendation, the patient will say, "Pam, what do you think?" So I get to explain the philosophy, the reasons, answer any questions that they have. My number one goal is to help keep my patients healthy. We now know so much that medicine and dentistry are interconnected. There are issues that people have with their oral health that can impact cancers, diabetes. They're even finding there are issues that could be leading towards Alzheimer's. So there's impact on oral health that affects your whole body, not just your mouth. So I'm an educator, and I want to let people know what we know. I chose to work at Friendly Dentistry because I was married and moved to Greensboro, and through reputation heard that this was just one of the cutting edge great practices to work in. What excites me about Friendly Dentistry and say our cutting edge is knowing that we are continuing to grow. When I started in dental hygiene in school, they told us that 7 years was the lifespan of a dental hygienist on average. I've now been here 35 years, and I'm continuing to learn. We don't settle. If you do things the same way that you've always done, you'll never grow and do better. And I appreciate the technology, the philosophies, being able to take care of patients and not having a factory, a mill get you in and get you out. So that makes me continue to love what I do. What I like about the services that we provide at Friendly Dentistry is that we have 4 doctors. They all have their own little talents. Every single doctor here does do their basic crowns, fillings, but we also have doctors in the office that do sedation dentistry, which is so impactful for a person who comes in with fear. So we have 2 doctors that do that. We have some doctors who will do extractions. We have another doctor that is trained to place dental implants. We have a couple of doctors that do Invisalign orthodontics. What I have found is when patients find their dental home, if they can do in-house services, they love that. They have the relationship with us, they can ask us any questions, they're comfortable. And if there's any services that are beyond the doctor's ability, we work with wonderful specialists throughout the community. So we don't get in over our head. We're always going to put the patient first and what meets their needs.